Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune. If you're pregnant, that's good news, but have you noticed something like a fever recently or a rash? Or maybe you notice certain swellings in your armpits or maybe in the neck region, or you've noticed some kinds of sores or ulcers around your genitals, or it could be that you've had a miscarriage in the past, or maybe you haven't had all your vaccinations done. If this is you, then your doctor may have recommended something called the Torch panel test, which is a blood test that I'm going to tell you everything about today. To start with, let's know what is torch. Torch has got nothing to do with a light or a lamp. Torch actually is an acronym or an abbreviation for a set of blood tests which are all related to a series of infections. So the T stands for toxoplasmosis, which is a type of an parasitic infection. The O stands for others, which are a group of infections all clubbed together under the word others because nobody could find a better word for it. The R stands for rubella, which is another viral infection. The C stands for cytomegalovirus, which is, as it says, another viral infection. And the H stands for the herpes viral infections. So torch actually represents a group of around 5 to 8 different infections depending on who you ask. And these infections are commonly tested in pregnant women and also in certain groups of adults when certain infections are suspected. The most important reason to test these infections is in women who are pregnant, because these infections can have serious effects on the child that is to be born. So that's what TORCH stands for. Since the most common reason for advising the TORCH blood test is usually in a pregnant woman, a lot of people ask us, why does this even matter? The TORCH infections are unique infections in that if a pregnant woman is infected with any of them, especially during the early part of the pregnancy, it affects the newborn child. It affects the child that is developing inside of her, and it can have extremely serious consequences on the health of that fetus, including death. So this is very important to know if this woman is already infected with one or more of these viruses or parasitic infections, and the treatment can be started on time. If you don't diagnose these things on time and if the pregnancy is allowed to proceed, the newborn will almost certainly in some cases even have up to a 40% chance of being born with some serious problems, all of which could include things like deafness, blindness, problems with the brain development and growth retardation, all seizures. There is an n number of things that these infections can cause, and so it's very important to get tested for TORCH, especially in the earlier parts of your pregnancy. So what is the TORCH panel test? Up to this point I've told you what TORCH stands for. So what is the TORCH panel test? Well, this is a single blood test in which we will test for all the infections that are listed under the TORCH acronym. So it's a single sample of blood, and what we actually look for is not the infections themselves, but the defense antibodies that your body would make if you were infected with these infections. In many of the infections that occur in humans, most lab tests do not ever directly detect the infection because it's very hard to isolate infections, the infective organisms from your blood. Instead, it's much simpler to isolate antibodies, which are basically proteins that your body makes to fight against these infections. The good part is that the body makes a unique protein to fight against each type of infection, and so if we find those proteins, we can be certain that you've been infected. The TORCH panel includes the detection of both short-term and long-term antibodies against these infections. So whenever you're infected with any kind of an organism, your body will make two types of antibodies to deal with it. One are the first and the early responders are called the IgM class of antibodies, which are the ones that will be created very soon after the infection, and they'll last for maybe only 3 months. And then the body also makes something called the IgG class of antibodies, which last sometimes your entire life and usually try to give you lifelong defense against this infection should it ever recur. So the TORCH panel test is a blood test that checks for both the short-term and long-term antibodies against all the infections listed under the TORCH acronym. So how does this help? If you are found to be positive for one of the TORCH infections or one or more of them, doctors can judge whether your fetus is at risk of developing serious consequences of these infections. Treatment can be started on time, but more importantly, the fetus can be monitored even in more depth during the course of your pregnancy as well as immediately after birth for any signs of having been infected by one of these organisms, and maybe early treatment can be also started for the fetus. So that's why it's very important. Let's know a little bit about the different infections so that you know what we are dealing with. The first one is Toxoplasma, which stands for the T in torch. Toxoplasma is a parasite that spreads through cats. It is usually contracted by ingesting uncooked meat that is contaminated with the feces of cats. The Toxoplasma is something that will infect the mother, and it will also affect the fetus that is developing within her. In the fetus, it can cause some serious problems like an eye infection. It can cause brain swelling and other serious complications, which are going to be very difficult to deal with later on. So Toxoplasma is very important to get tested. As you can realize, it's more common in people who are in close association with cats, so that's something to bear in mind. The next one we're looking at is Rubella, which stands for the R in torch. Rubella is a virus. It spreads through air, coughing, sneezing, droplets, maybe even close contact with people who are infected. In the mother, it will give you symptoms like a rash, a fever, a cough, or a cold. But in the fetus of the pregnant woman, this can cause some serious problems like having a small head, eye diseases, heart diseases, and even hearing defects. So it's a pretty serious infection to contract when you're pregnant because it will have an effect on your unborn child. Next, we are looking at the Cytomegalovirus, which is maybe one of the most serious of the torch infections. It stands for the C in torch. It is an airborne virus, but it can also be transmitted by kissing, close touch, coughing, sneezing with those who are infected. This is a virus which in the mother will just produce a mild fever and body ache. She may not even realize that she has something serious, but in the unborn or in the fetus, it can cause a small brain, eye diseases, and even hearing disorders, which means hearing defects. If the mother is infected very early in the pregnancy, it can even cause death of the fetus. So it's a very dangerous virus to have in a mother who is pregnant. Lastly, we are looking at the H in the torch, which stands for the herpes infections. Now, herpes viruses are very widespread in human beings. Almost everyone has been infected with some type of herpes probably once in their life. The herpes virus, if infects the pregnant mother, it usually spreads through intimate contacts, and it will produce genital sores in the mother, and in the fetus it may not have much effect on the child in the fetus and the stage when it's a fetus, but after birth it may be contracted through the vaginal passage, and it can cause things like boils, rashes, as well as fits and heart diseases. All these things are possible. So herpes is equally dangerous, and that's why we need to test for all these different viruses and infections in the pregnant mother. So here is a complete list of all the tests that are actually done in the torch panel. So the first you can see is the Toxoplasma IgM and the Toxoplasma IgG antibodies. We then have the Rubella IgM and the IgG antibodies, the Cytomegalovirus IgM and IgG antibodies, the Rubeola, which is actually stands for German measles. It's another type of virus which is airborne, which also has serious effects on the fetus. Again, there too we do the IgM and the IgG antibodies, and the last is the herpes 1 and 2 IgM and IgG antibodies. Herpes are of two types, herpes virus 1 and herpes virus 2. So we have to test for both of their IgM and IgG antibodies. There are certain optional tests that are done by certain labs or if advised by your doctor. These fall under the others category. These could include HIV, Hepatitis B, VDRL, which is a test for syphilis, and sometimes even things like parvovirus is also tested for in certain labs. But the most common tests are the ones on the left, which I've included here. So these are all the tests that should normally be done in a torch panel. How is the torch panel test done? Well, there's no special preparation that's required. You don't need to be fasting. It's a single blood sample, and usually you will have all the results within 1 to 3 days from any laboratory. You just need to provide a blood sample. There is no special time at which you have to give the sample. You can give it at any time of the day. It's important to know that certain lab equipment can be affected if you're already on biotin supplements, which are just nutritional supplements. So please inform your lab about this. But other than that, there are really no preconditions for this test. What are the normal ranges or the expected values for the torch test? So you can see that almost all the results should ideally be negative. There are only some exceptions. For example, Rubella IgG, this could be positive if you have received the MMR vaccine at any time in your life. So that's expected to be positive if you were vaccinated. If you were not vaccinated, it should be negative. And other than this, almost every other thing is expected to be negative. What happens in practice is actually that most people will show a positive result for the IgG antibodies for many of these things, and that just implies that they had been exposed to the infection at some time in their life. It does not mean that they currently have the infection. As I told you at the beginning, the IgG antibodies are the ones which give you lifelong immunity. So even if you had the infection as a child, let's say you had CMV infection as a child, your CMV IgG antibodies will stay positive for the whole of your whole span of your life. And so you should not be concerned, because IgG alone being positive usually is not important. It just means that there was an infection at some point in the past. But in a person who has never been exposed to any of these infections, all the results should ideally be negative. How to understand what the results mean? This is a very big question that a lot of people have. So as I already just told you, if any of the results of the IgM category are positive, this is important, because the IgM antibodies will only be positive if you were very recently infected, usually in the last 3 months. Doctors are always looking more closely at the IgM antibody results, and if any of them is positive or even indeterminate, somewhere in the middle, in the gray zone, they're going to be concerned and ask you for additional tests. On the other hand, if the IgG antibodies for any of these infections are positive, it's usually not something to worry about, because it means that you were infected by this infection or this particular organism at some point in the past. Again, if you were infected by, say, if your IgG is positive for certain types of infections like, say, Toxoplasma or Rubella, and your doctor suspects that you currently have the infection, they will ask you to get additional tests done. Maybe a DNA test or a PCR test will be advised to make sure that you don't have that infection, and it is just showing positive on IgG because you were infected at some point in the past. So as a rule of thumb, just pay close attention to the IgM results. That's where we want to be sure that all of those are negative. If the IgGs are positive, it may mean that you had a recent an infection in the past, maybe 6 months or 9 months, and your doctor may decide what to do about that on a case-to-case basis.